Hello,
Hey,
Gene.
hey, Bill, how's it going?
All right, man. Happy New Year. This is our first.
Happy New Year. And it's
Yeah,
a double Happy New Year because we have the New Year, the conventional New Year, and then we also have the Chinese or Lunar New Year
that's
that
right.
is here. So Happy
Actually, that's
Year of the Snake.
Year of the Snake. Yeah, it's ongoing right now, so, as I understand. So, and because I have a colleague, it's in Hong Kong, so we weren't going to meet this week because of that.
That's right.
I guess it's a big thing for families. They all get together, just kind of like what we do. Same thing.
Oh, yeah, I used to have a trainer who they celebrated the Chinese New Year, and it was such a big deal. He told me all these kinds of stories about the things they did. It sounded
Yeah.
magnificent.
Well, and that's a good setup for the Year of the Snake is about transformation and stuff. And so
Yeah,
we have something pretty transformative to talk about today.
we do. Indeed.
Indeed. So why don't we? I guess we should give the folks just a brief overview of what's coming for this year in the
Sure.
Bioactive Nexus. So we are planning some more of the Bioactive Breakdown series. So Gene and I are brainstorming on topics for that and potential guests that we're going to have on. So, obviously the hot topics, things that we know. Any other thoughts you have on that, Gene? What we're talking about?
Yeah, I just want to say that I've really enjoyed so far when we've done the bioactive breakdown where we have a few different guests together. I
Yeah.
feel like we get to do a deep dive and get different perspectives. It's not that you and I don't have different perspectives, but there's so much that we are kind of in sync with that it's interesting to get some other kinds of perspectives on some of these topics. I think it makes for a much more enriching episode when that happens.
I
So
agree.
I'm looking forward to that.
Yeah, me too.
So let me just talk a little bit for a moment about the purpose of this particular episode. We're going to introduce something called NutriSelect AI. And in my humble opinion, it is groundbreaking. The short version is it's an AI-powered app for dietary supplements. And it fulfills an incredible need in this business. It quite literally solves some industry challenges, some problems, and it will empower consumers at the same time. And honestly, I think this thing is going to reshape our industry, which is around a $68 billion industry, dietary supplement market. So this is going to be something I think that is going to be the next big. So I'm going to start it out because this is really Dr. Bill's brainchild. And I'm pleased to be on the scientific advisory board for it, but it's
Absolutely.
his brainchild. And I have some questions regarding this. So my first question is, Bill, as the founder and the CEO of NutriSelect AI, what specifically inspired you to create this platform?
Well, thanks, Gene, for the intro there. And yeah, I think we have to go back to 2018, actually. So I was working with another venture through Latin America and South America and Mexico, and my partners were down there. And I was contemplating, with the initiative that we were working on, how can we change research? I struggled with this over the years. I ran my own CRO some 12 years ago or so, where I was doing clinical studies for some major product brands out there, but the industry wasn't really jumping on that. And of course, we talked about this in a recent episode on the science revolution, right? So a lot of new folks to the game, and some that have been in it for a while are jumping in and really pushing forward on doing research on supplements. But and there's the conventional approach of doing double-blind placebo clinical trials, et cetera. And I was thinking, how can we actually change that and put it up on end? I wanted to totally change the model of how we do that. And that's what start thinking about that and actually doing a technology play in that space. So I actually even started researching a distributed ledger-based technology. So what is that, you might ask? So
I might ask that, yes.
it's the same platform or technology, and I even read the white paper on this, which was really hard to understand. The Bitcoin and was started on it, and it actually is being applied to other industries. But that got me thinking about how to apply that to our industry and research, and that's where it started. So I guess that's where it started, but it's certainly evolved quite a bit, and we'll dig into the details of NutriSelect today. So
yeah, we certainly will. Okay,
yeah,
so look, you have a great deal of experience in the dietary supplement industry, as do I. So, can you share how your experience in the industry shaped the vision for NutriSelect AI?
Sure. So, Gene, I think we've talked about this before, but you've had the same thing. We've both been in the industry a long time. And for years, people would come up to me and say, "Hey, Dr. Bill, what do I take for this?"
Yeah,
And it's a common question that, we get as subject matter experts, right? And, our spectrum of knowledge is, I can't do it how wide it is on the screen here, but the average consumers here and doctors are about the same, by the way. They don't really have that knowledge base as well. But then way out, as far as I can spread my arms, there's 100,000 products on the market in the US alone. So how does a consumer know what product to take for them? Which one's actually going to work?
that's
That's
right.
that's where um, been my experience, and this is what I was contemplating a year ago. I was like, okay, what's my next move in the industry? Yes, I've taken dozens of products to market I've developed, and they're always based about the science. I said I can do that again. But I asked myself the question, and I was meditating. I asked myself the question after that, and I said, what is the biggest problem in this industry that I could solve? And then, boom, it's like a light bulb went off. Aha. Oh, yeah. People ask me this all the time. So I spent all of last year doing due diligence to investigate, could the technology support my vision? And I was already studying AI technology for some years now, as I said, since back in 2018. So I already had this kind of knowledge base there, and I started exploring that and interviewing engineers around the world and stuff like that. And the answer was yes. So that's what led me to develop NutriSelect AI.
Okay, we're going to talk about a number of things today in regard to this particular technology. But what do you hope our listeners today are going to take away from the conversation about NutriSelect AI?
I'll use this as an example. I was flying back from Tampa, Florida to Dallas last week, and sitting next to a guy in the oil business. He lives a healthy, tries to live a healthy lifestyle. He takes supplements, and we started talking about NutriSelect. And as I'm explaining it to him, because when you have someone like you explain this to me, I said, I'm totally sold on this. This is like incredible. I can't imagine the amount of time and money it's going to save me. So my takeaway for this is, and by the way, we are targeting, B2C or end consumers first, because first of all, I don't think our industry does a great job of servicing our end consumers. We go to our trade shows and pat each other on the back about innovations and new research and all this kind of stuff, and it's great. And the product brands do this, but they don't always do the right thing in terms of marketing their products. So at the end of the day, let's turn it on its end, let the consumers drive the change here. So this is putting the power back in the hands of consumers. So what I'm hoping that listeners will take from this, and including people of us who are in the industry who are supplement users, is that, wow, finally there's going to be a tool that I can use this, that I can actually don't have to worry about it. It's going to take me right to the kind of products that I really need.
Very good. Now, as with most really interesting new developments that come into the market, they're there to solve a problem. And I think it's worth having a little discussion about the problem with the current market.
Sure.
Okay, so look, right now there's over 100,000 products on the market, supplements, and let's say conservatively 70 to 80% of them mislead consumers. When I say mislead, it's through unverified claims, unsubstantiated claims. A lot of challenges for people to find scientifically backed, effective supplements. There's a lot of consumer trust issues, and we've talked about this before, Bill, about the bad actors in the industry saying outrageous, crazy, unsubstantiated things about their products.
That's
and
right.
It leads to bad trust. So, with that in mind, I have these questions. What do you think would be, say, the biggest challenges that a consumer faces when they're trying to find quality dietary supplements today?
Well, it seems obvious to us, but as I talk to people like I did just recently, I talked to everybody about this who are not necessarily from our industry, but are just end product consumers. And I've actually surveyed daily dietary supplement users and gotten the responses from them. And the biggest challenge that they say is it takes them a long time they spend time searching on the internet, they're Googling whatever, or they spend time trial and error buying products and wasting money by something that doesn't seem to work for them. So these are the two pain points, I'd say, is the time and money for the end consumers. And it seems obvious to me. I know this, and I think you understand this as well, being in the industry. We know what those problems are as an industry. But again, we don't do a good job of servicing those end consumers to make sure that they are getting the right products and all that. Okay. So these are the biggest challenges I would say for sure for the end consumer.
Yeah, I'd agree with that, Bill. So, we talked briefly about bad actors. So I'd like you to elaborate on just how those bad actors are harming consumer trust and the market as a whole.
Well, we've seen it for years, right? We've seen bad press with products get pulled off the shelf, don't meet label claim. The famous one, the famous myth, supplements are not regulated. How many times have we heard that over the years? I mean, and actually to the point where the consumers don't know, they actually believe some of this stuff, right? They believe some of this. There's a lot of misinformation out there. So the bad actors, why do we have bad actors? Okay, they're not going to go away. These are the opportunists that see an opportunity, like when COVID hit, or now with GLP-1, people are jumping on the bandwagon to come up with solutions for consumers, right? But the reality is that's not going to go away. And it's very difficult to combat that. You can spend a lot of time and money trying to do that. So for me, this is NutriSelect is a solution for that puts the power back, like I said, in the hands of the consumers where they can drive that change, right? So we're always going to have bad actors, but it's going to get more and more difficult for them to, once this really goes big, like I envision it to do, it's going to get more difficult for bad actors or companies who don't support substantiated their claims they make. They won't be able to compete in the business because consumers won't buy their products.
From your mouth to God's ears, I sincerely hope that. And I think that this technology is the best chance I think we have of achieving that goal. Okay, so next question.
Yeah. Actually, before we go to the next question, let me add one more thing to the bad actor piece of this.
Yeah.
Not only does it harm consumer trust because people don't trust our industry, they don't think we're regulated or whatever, but it really continually paints a bad picture for the industry as a whole. It only takes a couple bad actors, and I started to say this before. Why do we have bad actors? Well, the barrier to entry in the U.S. market to put a supplement on the market is relatively low. So there's not a lot of stringent requirements there, which is why people want to put forward mandatory product listing. We've talked about that before. But again, that's not going to solve the problem as a whole. So I just want to add that to that last part.
No, that's a good point. All right. Look, it's difficult for consumers to differentiate between effective science-backed products and those products that are actually misleading. Why is that?
Well, I'll just take a simple example. So we've done it ourselves probably. We go on Google to search for a product for, let's say, stress, right? So guess what's happening on the back end of that? You're searching in Google. Well, some companies got money paying for those keywords that you're searching. And what's going to come up in your search feed is going to drive you to a particular product brand that supposedly is going to solve your issue, right? The problem with that is it may or may not be based on scientifically validated claims there. So
yeah, that's right.
And quite often, more than not, it's not. Considering that, I hate to say it, it's 70 to 80% can't even validate their claims. Okay,
it's true.
And it's not just yours and my kind of assessment of being in this industry for decades, but this is other colleagues that I've had conversations with. I actually had a lower number in mine, and someone else has quoted it higher, and it's like, okay. So we have a rough idea. You know what we're going to find out, though, when we do NutriSelect and we do get it out to the full scope of all the products in the market, we're actually going to find out what the real number is of products that really can verify their claims.
Yeah, we will.
That's exciting for me. But anyway, you were asking about, how can the consumers differentiate? Because that's one reason it's difficult, because they can't get to necessarily understanding where the products are. It could be a product brand that's got great research on the product, but they don't do a good job of marketing, right?
Or conversely, the other. They have crappy research. They have none. There's no
Right.
science to it, but they do a great job marketing. You see
Right.
that all the time.
So it makes it very difficult for consumers to really key in on, to the point where the ones that take them every now and then just give up and say, I don't even know what to take. It's too hard for me to figure out.
Understood. Okay, so we understand a little bit about the problem. What about the solution? Well, the solution that we're presenting today is the NutriSelect AI. Okay, so I would like you to, well, before I ask you the questions, would you explain I have some questions, but I'd like you to explain just a few things first. I'd like you to explain a little bit about AI, the AI-powered scientific rating system, personalized recommendations, as well as tracking and insights. Let's start with AI-powered scientific rating system. Explain a little bit about that.
Sure. So one of the key, obviously I'd say the key feature of the app, and there's several features here you mentioned. Again, these personalized recommendations are really what I call precision supplementation. So I'm going to kind of talk about all this together here, Gene. So for example, we've had this discussion for years in the industry about personalized nutrition, right? But
Yes.
nobody's ever cracked the nut on that. There's a lot of different companies that do that. And then basically they're recommending products. Well, it's the same product they're recommending to thousands of people, right? It's not necessarily personalized. Okay. It may be personalized in terms of a questionnaire or something, but this is going way beyond that. This is disruptive and it's revolutionary technology. And the way we're able to do that is through our scientific rating system. And so let me talk about that. Let me describe this, the scientific rating system, how we're leveraging AI, and how that's going to work to evaluate supplements on the market. This is a really key thing because I want to stress this is not a pay for play sort of app. So product brands are not going to be able to pay to get a higher rating. It's blind to whatever the brand is. It's based on what the formula of the product is, what ingredients are in there, and it's evaluated in that way. So let me just give you kind of an overview of what the rating system looks like and give you an idea. It's a complex algorithm we're developing on the back end, leveraging AI. But something that I think a lot of average consumers don't understand about AI is we've seen Chat GPT and all these kind of on the surface, right? Well, they scrape the internet of available knowledge, right? And yes, they do it very fast and they learn a little bit from what you're doing. But something like we're talking about goes much deeper than that. It goes to the data sets you're developing. And as you know, Gene, you're on the scientific advisory board along with some other stellar folks and colleagues of ours. We're going to develop this rating system, working with the engineers to train the data based on the data sets that we develop. So in the dietary supplement industry, there isn't a universally accepted or standardized scientific support rating system, right? But there's frameworks and criteria sets that we use as researchers or industry experts or third-party certifiers, right, to assess quality and credibility of supplements, right? And so, for example, the source of the evidence, it could be human clinical trials on the product, right? And that means
Right.
on the product as a whole. It could be human clinical trials on the ingredients. It can be animal studies, in vitro research. It can be traditional use or anecdotal evidence. These are all sources of the different evidence that we evaluate as researchers and product developers, right? The next thing is the quality of the evidence, right? So is it a randomized controlled trial, right? Which is kind of the gold standard. Is it a
Right.
cohort or observational study? Is it a case study? Is it expert opinions? These are all variations of ways to assess the quality of the evidence. And then, of course, the reproducibility of the results. Are they replicated studies? In other words, they've been replicated in multiple studies, or is it just a single study? Okay. And the next category is the research scale and scope. Okay, sample size. Is it a large, statistically significant sample size? Does it have geographical diversity? And then you got to take into account regulatory and certification marks. Does a product have third-party testing like NSF or USP or something like that? Has it got GMP certification? Is it organic, non-GMO certifications, right? These are all going to factor into the quality of a product, and transparency and label accuracy. So how accurate are the labels and the claims they're making? Are the dosages aligned with the research? These sorts of things. And full ingredient disclosure. So we've talked about this before. No fairy dust products where we don't know
Yep.
where
Yep.
we don't know how much of anything's in there, and they obfuscate the real value. And basically, you're buying something that's not going to do anything for you. So all of these factors are going into the development of this complex NutriSelect scientific rating system, which is pretty exciting, Gene, because
Yes, it is.
once we get it dialed in where it really knows what it's doing, then it's going to be very accurately assessing all research on the ingredients and looking at the combinations, factoring in all of that, and give us a rating based on that. So to me, that's super exciting.
That's right. I see that. That's why I think that this is going to be the biggest thing since sliced bread. People are going to be able to actually have a reliable method for determining what, not only what they need, but which product actually has the science to support it. I think that's huge, and that's what that whole personalized recommendation is all about, really. But what about tracking and insights as an
Okay.
element to this?
So, are you talking about the personalization features in terms of the
Yeah,
progress
yeah,
tracking, right? Okay,
right.
so yeah, so for before we get into that, let me kind of back up basically kind of an overview, high level of how it works, right? And what makes it, first of all, there isn't anything on the market like this. I mean, we are creating something new. There is a lot of apps in the market in the health and wellness fitness space. That's a multi-billion dollar industry in itself. And there's some that are targeted on foods, cosmetics, or whatever, but nothing on supplements like this, and
No.
nothing to the level that I've just described with our rating
And
system.
in fact, when we had our first meeting of our scientific advisory board, everybody kind of contributed to that and agreed. Nope, they know some of the other things out there. There's nothing like this.
That's right. So the way it works is, and it'll start out as a mobile app, right? It'll be on your phone, and but it also have a web presence as well. But it's going to have features which are going to enable, which you're going to want to have on your phone. Like say you're out shopping, you want to scan a barcode or a product label or whatever, and see what the rating is for that. Okay, but once a person signs up for the app, then they're going to input all their information, they'll make it personal for them. And then they can either just say, hey, I want a product for stress. Boom. It'll go through and give them from our supplement marketplace. It'll tell them where to find all the products that. It'll give you the rating systems, and you can sort those based on the rating system. You can find the ones most highly rated. And then you could find your favorite brand, maybe that's got a good rating or something like that. And then once they pick those supplements and then they start taking those, then there's a whole product progress tracking feature in there. Think about that for a minute, Gene. The power of having in real time, and by the way, it's going to, we'll talk about this in a minute with wearables. It's going to work with all the wearables out there, whether it's Fitbit or a Ring, whatever, it doesn't matter. And there's a lot of new technology coming out in that space as well. But it will track their progress in real time. They'll input, the product they're taking or whatever, and they'll start to see the benefits themselves on their phone or on the website, and they'll be able to see all the information about their profile and all of that.
That is pretty cool stuff. I mean, that really does address the whole personalization aspect of it.
Right, it does.
Really tailoring recommendations for the individual users. It's a pretty powerful tool, and I like your whole description of the scientific rating system. I think that's going to be something that'll be second to none. Some pretty cool stuff. So with regard to some of the key features, so we're looking at, so when we've talked about this, we talked about onboarding and personalization.
Right.
We've talked about evidence-driven supplement marketplace and updates with regard to the latest research. So with regard to some of those key features, I got some questions.
Sure.
So what would you say are some of the technical innovations that are now allowing NutriSelect AI to deliver the evidence-driven recommendations?
A couple things there. So first of all, we've kind of touched on this a little bit already. It'll certainly be personalized for the consumer, the end user, and based on their profile. And what I'm calling precision supplementation, which means it's going to be very precise for that individual because that individual is going to be tracking their own personal progress. Now, this is true personalized nutrition, okay? But I don't even want to call it that because it's so much more advanced than that. But let's call it precision supplementation, right?
And I like that better. Yeah.
I like that better because it is precise. It's totally for that individual, okay, which nobody's ever done. And of course, they're tracking their progress. Say they're tracking their progress in immune and stress and sleep and all these different factors, and they can see where they're making improvements. Well, in real time, they're also going to receive research updates on the latest research. Let's say a new study comes out on a particular ingredient of a product they're actually taking, but also could make recommendations of other things that they may not be taking that they can enhance and be proactive on their health, right? So there's a lot of back end things that are going to work and evolve for that individual user as they use the app continually, right? It's going to be, it's actually, it blows my mind to think about it. It almost like Star Trek for me. You go lay down in the scanning bed, or you got the scanner.
Right.
It's like it's going to be on your phone. It's essentially going to be doing almost exactly the same thing in terms of the end result.
Well,
But
we talked a little bit about, well, I'll save that for later because you just reminded me of something, but I'll save that for a later comment. That is just so very cool on what this
yeah,
thing has to offer.
so it's not just an app to say, okay, where I get the supplement. No, it's
Right.
way much more than that. It's going to be a totally engaging, immersive experience for the user, where they're going to have that with them all the time, out shopping, whatever. And yes, maybe they got their dozen supplements they take every day. They're going to be tracking that and together with all this incredible data on themselves. It's phenomenal. So it's really taking proactively control of your health.
Now that is so awesome. Well, okay, look, some practical aspects of this from the business side. One of the things that I really like is that when we've discussed this, and I've asked you about, what do you see this subscription selling for? You know, I've seen models out there on other kinds of subscriptions that are pretty expensive. And I like the fact that for you, you really wanted to make this affordable for
Mm-hmm.
almost anyone. And so your suggestion of a subscription fee for $9.99 is, I think, pretty amazing. What you're going to be able to get, how you're going to be able to get the information and the tracking and everything that you need for that fee, I think is going to be within the reach of most people who use supplements. I mean, that alone is going to save them just tremendous money.
Yeah.
But in addition to the direct to consumer model, I know one of the other things that we discussed was say future opportunities for a B2B partnerships. And so what I'd like to ask you is how do you see NutriSelect AI with regard to partnering within the industry to improve transparency and to raise standards?
Yeah. So you're right. The subscription model is very affordable. And, we did a lot of due diligence on this. I researched that, in the health, wellness, fitness app space, it's anywhere from $9.99 to $30 a month for some of these. And it also involves, in some cases, actual devices to buy that cost like $300, So
Yeah, right.
Lumen is a good example of that company and what they're doing. But they don't offer kind of the features we've already talked about. So for $9.99 a month, and I've already posed this question to dietary supplement consumers. So there's daily supplement users. It's 188 million people in the U.S. alone.
Yeah.
Okay, that take supplements every day. So that's the market we're targeting. Certainly, everyone that's spending. So it pays for itself because you're not wasting hundreds of dollars buying supplements that you find out don't really work for you or don't really have the science you find out or whatever. So you've wasted that money. It's expensive. Supplements are not cheap.
Bill, I'm going to tell you something.
Yeah.
You and I are two of the more knowledgeable people in this business. And when it's ready, I'm subscribing to it because
Yeah.
it's going
I
to do
know.
things, and I know you'll use it too. It's
Yeah.
going to do things and
Yeah.
give us a certain level of information, if for nothing else, for us to be able to say, okay, what products out there actually have these things in the right form? And
Right.
you're still going to have family members. I got like my 90-plus-year-old parents. They're not going to
Right.
use an app. What can I use? And I'll just go click, click, click. All right, now I do it a little bit more slowly.
Yeah.
It's going to be great.
And right, like so, Dr. Elijah talked about this. He's on our scientific advisory board. He's an ND, and he said it'd be great to have that for an intake. So let's talk about some of the B2B things I see partnering with. So I see partnering with doctors. Okay, I see partnering with nutritionists, dietitians, that sort of thing, where they can have this tool to do patient intake with their patients, right? They can basically go right in there and put the profile in for their patient and do it themselves. So for someone who's maybe not be tech savvy, their doctor could do it for them, right?
Mm-hmm.
That sort of thing. That's one avenue, and of course, product brands, right?
Yes,
So
product brands.
so as this, imagine when we have 1 million users. This is a fraction of the 188 million, but even 1 million users, we're going to reach a critical mass of people are buying certain product brands. And some product brands are going to get elevated because they're spending the money on research, and some are going to start to fall by the wayside and lose sales. Or they may come, we're going to be approached, I know, and then we're going to say, hey, my product only has a 5 out of 10 rating. Why is that? And that's an opportunity for discussion, right? To say, here's why we rated you at 5 out of 10. And it's not we did that personally and arbitrarily signed it. This is how our
The
algorithm is signed.
technology did. Yeah.
Yeah. Yeah. And it's based on the level of evidence and support you have. It's a multiple factors here or variables and sort of give you a rating. So this to me opens up the conversation for those product brands who actually do want to improve
That's right.
to grow their product brand and grow their audience. So how are they going to do that? They're going to do more research. They can do it in a very strategic and targeted way. We can actually guide them on how to go there. All right. So that's the second kind of B2B. The third one, actually, it's probably four here. The third one is like, think about the big retail box chain guys. So Walmart, Whole Foods, Costco, whatever, anybody like that. I can see us partnering with them or a Walgreens or something like that, where they're going to use the tool to screen products to put on their shelf. Now, won't that raise the standards for the industry?
And you know what else? You know what else it's going to do?
Yeah.
It has. I don't want to be overly dramatic, but I think it has the potential to change how health outcomes in America today.
Yeah.
Because if what people are putting on the shelves are only the things that really have data to support its use, I think people are going to start getting better results, and we're going to see that.
Yeah, and we'll be able to track that progress in real time. So I see partnering with organizations like with Tim Ziegenfuss, for example, who's also on our advisory board with the Centers for Applied Health Sciences, or Radical Science guys, Jeff Chen and those guys, and Lithios, what Xenia is doing. We had him on our show, right? The Science Revolution.
Or reputable with those guys.
Yeah.
All of these different research groups.
Yeah. They're already doing that. We can drive those brands to that part of the industry to really elevate that and really grow that, really do
a study on your product. Let's show that it does what you say it does.
We could even go to product brands after, maybe it's a real popular brand that everybody's taking and we've got this X amount of data, but they don't even realize they have this data on their product. We can go to the product brand and say, hey, are you interested to know how your product's rating here and how it's working for consumers that take your product? So there's lots of opportunities on the B2B side here. And I could also envision a version of this tool for the FDA inspectors. Okay.
Sure, why not?
I mean,
somebody's got a claim. Is it substantiated? Click, click, click. No, it's not. Yes, it is.
Yeah. So some people are not going to like what I'm doing here, Gene. That's okay, but we're going to clean up the industry. And
I appreciate it. How many times have you and I, together, and then before we ever met each other, had the conversation about the bad actors, about the people who were giving the industry a bad name, about how I wish they'd stop it. And here is something that whether they do or not stop it's going to impact their business and force them to clean up their act or get out.
Well, that's a good segue into the next part of this, which is what the impact it's going to have and what I envision.
What is the impact? What is the future vision? All right.
Exactly.
So look, NutriSelect AI, the benefits to consumers we're talking about is, providing confidence in their supplement choices, which hasn't always been the case.
No.
Promoting transparency and science-backed decisions.
Exactly.
And to me, perhaps the most important thing here is combating misinformation in the industry. So here's my billion dollar question. How do you envision NutriSelect AI changing the way consumers approach dietary supplements?
Well, I mean, I'm going to say it again. It puts the power back into the hands of the consumer. They're not beholden to the product brands who are slaughtering them with marketing ads and advertisements and that seem convincing to buy their product, right? It's going to change so many things in terms of the impact. And at the end of the day, I'm doing this for the consumers. I'm doing it for the people who've up to me countless times for years where I want to help them and I don't always know what to recommend for them. Okay. This is going to give me the tool to be able to do that and actually put it in the hands of those consumers that can do it themselves. And for me, that's a very, very cool thing. And we'll get to some future goals of what I have in mind here in terms of the impact. But yeah, for sure, that it's going to change the way consumers approach buying supplements altogether.
Yeah, yeah, I agree. So let's talk about some of the future goals. One of the things, and this is what started me thinking about it earlier, and I was going to say something. And I went, no, wait, we'll get there. When we were talking about like the whole Star Trek thing is
Yeah.
This whole precision supplementation concept,
Yeah.
but integrating it with some wearable devices. That's wearable technology. I think it'd be interesting to look at that as a future goal. And we've talked about that. And also the role of AI in helping to shape the next generation of health products. And so here's my question for you. What long-term impact do you hope NutriSelect AI will have on the industry as a whole?
Wow. So I'm going to go really big on the vision of what I see happening here. So we've already touched on the others. Sure, more transparency, change the buying habits of consumers, power back into the hands of the consumers, product brands that either going to have to get on the train or get off, right? All that's going to happen. But here's the biggest one. Think about how it's going to turn the tide of health for consumers proactively in their hands. Think about that for a minute. Think about the impact to our healthcare systems. If more and more consumers had a tool or a way to take control of their health proactively in a really positive way, in an impactful way. So that's a longer term thing that will evolve and happen, is what I envision. If I saw every supplement user using this, imagine the transformation that would take place in terms of health.
I agree. That's one of the things that excites me about this whole concept.
Yeah.
That's why I think if as I said earlier to report, if the stores, the Costco's and all of these of the world started carrying those products that were the ones that were the high rated ones and that not carrying the ones that were poorly rated, it said, okay, everything's got to have a, let's just say for the sake of argument, an 8 or above rating or something.
Yeah.
Otherwise, it doesn't come in the store. Man, what a difference that would make.
Oh, yeah.
In consumer health and wellness. So that's pretty enormous. Okay, so you mentioned some future goals like the integrating of wearable technology. We talked about that anyway. And the precision supplementation. How do you think those features could enhance the user experience? I'm excited about that one.
Yeah. So first of all, the app's going to work with every wearable technology out there. Every wearable tech that exists will be interfaced with our app. So that means, and actually I could even envision we might even develop our own wearable that goes with the app. That's a possibility I've talked to my technology partner about. In fact, she just got back from the Consumer Electronics Show a couple of weeks ago in Las Vegas, looking at doing an evaluation of the latest tech that's coming to the stage here. Pretty phenomenal stuff that's coming. So in terms of wearable tech, it will get to the seriously like Star Trek, where there's scanners and that sort of thing that are going to happen. That's going to tell what's going on in the body in real time, non-evasively, right? So we're already doing that with Fitbit and Oura Rings and all these different things. So again,
oh, sure.
Yeah, I mean, the apps are already going to be, and the progress tracking of all that data collectively is going to be really powerful for the consumer.
Let me give a hypothetical example.
Sure.
So let's say somebody says, I have stress and I got tense, I got tense muscles, whatever, I got stress. And they're going to take something. Let's just say for the sake of argument, it's magnesium. They decided to take magnesium to help them. And they're wearing, say, an Aura ring, and it's tracking variable heart rate,
Yeah.
which can reflect stress levels. And they're able to see, looking at their phone, they've been on the magnesium, and look at this, look at the change in my variable heart rate, which is they now know is a measure of stress. This is actually having a legitimate impact. Not only was it a good recommendation, it's working. I can see it. I can
Yeah.
visually see it.
And they'll be able to see it right on their phone. It'll show it right there in real time. That's what I love.
I
I
love
love
it.
I love the beauty of this. It's like it in real time, man. I mean, I actually use an app for my intermittent fasting that I track, and I can see in real time all the benefits of that, right? But so imagine our app attached with all the different wearable technology out there. It's really powerful in terms of what it's going to do.
Very, very powerful. Okay. And then my next question here was, how do you see the just sort of AI shaping, the dietary supplement and health products over the next decade?
Well, I can see. I've been thinking about this since 2018, James.
Yeah.
So I've been envisioning the future of what our industry looks like for some years now. But definitely, of course, everything we talked about very specifically with NutriSelect and what it's going to do. But I can see ancillary things, and this is true for a lot of industries, right? There's going to be technology coming that's leveraging AI to do that. By the way, before I get into that, let me just do a call out from fresh off the press from 2 weeks ago from CES, Consumer Electronics Show. My partner said, AI, you hear about it everywhere. Actually, it's starting to take a back seat. And the reason is because it's infiltrated everything. It's not, this is, if you lead with A, that's great, but we don't even have to talk about that. What we talk about is the features of what this app is going to do for the end consumer, the power it's going to give to them proactively control their health. That's going to be our focus of our primary messaging. Oh yeah, we're leveraging AI in the back end to do that. You don't have to know how that works, but we'll explain our rating system and all of that. But again, that's really important to call that out because that means we're in this transition or evolution of this technology phase where it's kind of like the new shiny toy sort of thing. Now it's becoming like everywhere. And
Right.
you're just focused now on the results of whatever it is, the benefit that it's being delivered to you from the technology. So that's where we're going to focus with NutriSelect is the benefits from the technology and the features of what it's going to do. But I can see it infiltrating the supply chain. This is the first thing that I thought about some years ago in terms of tracking traceability, farm to table, all kinds of things. Certainly, there's already an app out there that talks about doing formulation. I could see them partnering with NutriSelect, gathering data from us, and then being able to improve, or even we develop an app for formulation in terms of formulation. So I actually envision, Gene, we'll have our own product line here. You and I are probably going to develop our own product line based on the data and the information that we learned from this. That's exciting. So
It is
anyway,
exciting.
there's lots of possibilities on the future here in terms of how it's going to affect our industry.
All right. So before we close here, just a sort of few next steps. I want to encourage listeners who are interested to learn more about this to visit www.NutriSelect.ai. Now that's Nutri with an I, select.ai. And listen, Bill invites feedback and suggestions from any of the earlier adopters and from our audience. We'd love to hear from you. And I invite the same because I am on the scientific advisory board. Now, so looking ahead, we're talk just a little bit about the product launch later this year and some exciting collaborations and milestones to come. So questions, my final questions for you. What's next for NutriSelect AI? Can you give us a sneak peek of the roadmap leading up to the launch later this year?
Sure, I absolutely can. So first of all, we've already developed the prototype, and that was last year. We were kind of teasing that out at Supply Side West with some colleagues there,
I
Gene,
remember.
and you saw that, Gene. Very cool.
Yeah,
So
we were sitting down having lunch at the
yeah,
Tex-Mex place.
yeah, and so as I said, the prototype's developed. We're into the phase of MVP, which is minimally viable product. this is where we can start a really beta testing to see how some things are happening there with the app. And I should call out that we're not trying to tackle the whole 100,000 product supplement market at once. We're going to actually carve out the segment that's most interest to consumers today, and that's the whole mental wellness space. So cognitive, stress, mood, sleep, these sorts of things are we're going to target first and really develop the app to work extremely well for that. Then we can incrementally scale to immune, to digestive health, to these other areas. Okay, because the rating system is essentially the same approach no matter what the ingredients or product is, right? In terms of if it has clinical trials, quality of evidence, all the things I talked about. So that's kind of where we are. We're looking at towards the end of this year to launch this full commercial version of this. But of course, there'll be some beta testing and all that. So Gene already gave out the website. I invite you to go to the website, and there's a pre-subscribe page. Get on the mailing list. So then when we get ready to do this, by the way, Gene, I've already got people signing up for this.
Nice.
Virally, people I don't even know who they are. So this is kind of exciting. But anyway, that's kind of the roadmap for the coming months here. And I'm in the process of raising the capital we need. If this is something of interest to you in that particular aspect, then certainly reach out to me, DM me on LinkedIn, and let's talk.
And I think you've kind of largely already answered my next question about how do people get more involved or provide feedback. On the NutriSelect AI, just they contact you, they go to the NutriSelect.ai website and respond accordingly. Okay.
Yep.
Do you have a message you'd like to share with potential users, with early adopters, or let's say the broader industry community?
Wow. What do I say to that? Well, certainly everyone that's listening to this who takes supplements in our industry, go pre-subscribe, man. Okay, you want to be one of the first early adopters on that. Secondly, for we want to get this out more mainstream, Gene. I'm actually in the process of identifying product marketing agencies and type people who've actually taken apps to market. I've had some great calls. I've got some good leads in that. We're about ready to close the loop on that aspect. But everyone I talk to is super excited about this in terms of what we're going to do. And I guess I'll just close with my message for the broader industry community. And that is, guys, get on board to get on board with this. I don't want to hear any more discussion about mandatory product listing. I don't want to hear about bad actors, because you know what? If you engage with us on this, we're going to change all that from this other side of it with the consumers driving the change. Now, those product brands that are you got a target on your back. If you're making bad claims in there and you know who you are and you know you're making claims that can't be substantiated because you're trying to sell product, your days are numbered, man. So that's my message for the industry. I want to change the whole industry, Gene.
And I would just add to that, for those of you who are doing everything right, this is going to benefit you in a big way.
Huge.
And when we get to the trade shows, we're going to celebrate, sing, dance, and be merry, because the bad actors are going to fall away.
That's right. We'll see that at some point that'll happen, Gene. We'll reach a critical mass of users where it's just going to transform to the point where buyers for at Natural Products Expo West will be going around looking at products and saying, "Hey, what's your NutriSelect rating?" That's going to happen one day. And they go, "What?" Right. And they're either going to say, "What is that?" Or,
I don't remember.
I don't remember. Yeah. Oh, here. Well, let me check for you.
Exactly.
Yeah. So it's gonna improve the credibility of our industry, which I want to do. And I can't fight the bad actors or the bad TikTok social media influencers or any of that crap that's out there. But what I can do is change it from the other side with the consumers, because they're the ones. This is a highly consumer driven industry. They're going to change the industry. I'm just going to give them the tool to do it.
Awesome.
And that's
thank you for that. This absolutely brilliant idea. It's not too often you get a really, really brilliant idea that has the potential to make a huge change in the country, and this is one of them. So, yeah, I think that probably wraps it up for this episode of Bioactive Nexus.
It does. So again, go pre-subscribe, go sign up on the website, and stay tuned for future mailings to you. It's just putting your email address in there. So, and then you'll be able to stay up to speed and be at the forefront of this change, this transformation. and science revolution that we're going to make in the industry. And with that, Gene, I'll take us out, our usual outro, and we'll see you guys next episode of the Bioactive Nexus. We'll be back in February, which is not this next week.
Which is next week. Well, next week is February, but we'll be back soon.
We'll be back soon in February, and stay tuned for announcements on Bioactive Breakdown, the next in our series and stuff like that. Until then, I'm Dr. Bill.
And I'm Dr. Gene.
And by the way, it's Dr. Gene now. So,
That's right.
So now it's Dr. Squared here for the Bioactive Nexus. All right. See you guys later.
Take care.